Right here, news tonight in Indiana, the Hospital Association says hospitals in the state are expected to lose $1 billion over the next 5 years, and that could impact the services that you get from Indiana hospitals. Right here in New Albany at Baptist Health Floyd, the CEO says cuts to labor and delivery services could come if the financial situation does not improve. WHAS 11's Ian Hardwick learned why one of Southern Indiana's biggest hospitals runs at a loss.
A hospital so big it has valet parking, Baptist Health Floyd in New Albany operates at a loss.
Our percentage of government payers that doesn't even cover our cost continues to go up.
Mike Schroer, the local CEO, says about 2/3 of patients end up costing the hospital money.
So what we will continue to see if things don't change is more OB programs closing here in the state.
The problem is Medicaid reimbursements, which are generally less for labor and delivery. Overall, government insurance payouts are low.
For Medicaid, we get about 55 cents on the dollar of our cost. Medicare is around 86 cents on the dollar of our cost.
But Schroer said some expansions actually save money, like this urgent care center that opened in Jeffersonville, because urgent care visits usually cost less than emergency room visits. Under the budget bill passed by Republicans and pushed by President Donald Trump last summer, Schroer expects even less in government insurance payouts.
And we have actually seen the self-pay start to go up in the last 6 months because people, due to work requirements, no longer eligible for Medicaid, but they can't afford anything else.
However, he said Trump's push towards U.S. manufacturing has started lowering costs on some medications and equipment.
I mean, during the pandemic, we kept running out of things because they were from overseas.
After climbing the ranks from nurse to CEO, Schroer wants total reform
to redo health care here in this country.
Because he says hospitals and patients increasingly pay the price as government and private insurance pay out less. Reporting in New Albany, Ian Hardwick for WHAS 11 News on your side.
And just 2 weeks ago, Johnson County Memorial Hospital in Franklin, Indiana, closed its delivery department, citing low reimbursement rates. That follows the closure of delivery services at Harrison County Hospital in Corydon, Indiana, and that happened almost 1 year ago. Last year, the University of North Carolina released a list of hospitals at the highest risk of closing. Dozens are in Indiana and Kentucky. Here are the 12 identified as high risk in Indiana, including the Ascension St. Vincent Hospital in Salem, Indiana. That's because federal Medicaid and Medicare helps reimburse so many of these hospitals, which take patients in rural areas that don't make as much money. Because these patients will get less help from Medicaid, so will the hospitals, cutting into their profit margins significantly and impacting where you can get health care.